Thanks.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. I hope you're all fine and waking up to this hopefully beautiful, warm day. We're live. I want to thank Ed and Bob, who are running the studio today, and Therese Crowley for great news, as always. If you have questions, you're welcome to call us anytime during this hour. The WOR studio number is 1-800-321-0710. 1-800-321-0710. So there's lots to talk about. We actually have several programs over the weekend, and just overnight since the last program, I got a call from, let's say, Mrs. R. in Nashville, Tennessee, and she called to thank me, which is always nice. Doctors aren't used to getting thanks so often. Anyway, she came to me in 2003 with a brain tumor. She called me yesterday to tell me thank you. She said, I read about you. I knew you're from Iowa. I saw your credentials. And I decided to come from Nashville to New York for treatment 11 years ago. She said, we have a very famous hospital here in Nashville, but I wanted to be treated by you, even though I'd never met you. I read about you. She had a brain tumor. She had an acoustic neuroma, and she called to tell me that she was happy. She has a new scan. She's in complete remission 11 years later, and just thanks, Doc. So that was really nice to hear, and I appreciate that. It was very thoughtful. And another patient who called actually about their mother, who's in a hospital in New Jersey, and just diagnosed with lung cancer that spread to the brain. So when it spreads to the brain, it's still the lung origin of the cancer, but it got in the bloodstream and went to the brain, so it's stage 4. And the family heard about our work and our ability to hit the cancer, not hurt the healthy brain. And the child, it's not a child, it's an adult, the son of the patient said that they asked the doctor about it, and the doctor really got angry and said, if you go there, I'm never going to take care of you again, and you're on your own, and threatened the family. And the family didn't like how the doctor behaved, threatening the family not to take care of him if they come and see me. Well, it's a free country, baby, and you get to go where you want, and we work for the patient. So this doctor had the idea that the patients work for the doctor. It's not how it works. The patient is president of the United States, of their body. The patient and family want to come to me for consultation and treatment. The patient gets to decide. So if you have a doctor that's threatening you, I'm not going to take care of you. There's plenty of doctors who will take good care of you. And remember, the doctor is your agent. You have to be able to communicate and trust the doctor. So if the doctor's threatening you, well, might want to do what this family does, and that is make an appointment. They're coming in tomorrow. They're getting discharged from the hospital, and they want care that reflects their philosophy. They want to hit the cancer. They don't want to be threatened. They don't want to hurt the healthy tissue. They want to do treatment fast, outpatient, have their mother at home, not in the hospital, not getting stuck and woke up and all the noises, and we know all the super infections. And we also know there was just an article in the AAPR journal that said if you get your radiology services as outpatient, you'll save up to 50%. Well, actually, we know in certain cases you can save up to 90%. Our costs are about 90% less than certain hospital procedures, so you can save a heck of a lot of money. We had a patient who had prostate brachytherapy elsewhere. They charged, and he paid $70,000 when our whole treatment was less than $4,500. So that's about a 95% savings. And someone's got to pay. Someone pays for the hospital. Someone pays for the president of the hospital making $1 million and all those other people. So you get to decide where your treatment is. You get to decide if you have a doctor who speaks to you, who pick up the phone, or if you speak to a machine and speaks to the secretary or student. We don't do it that way at Radiosurgery New York. Here, you have a doctor that represents you, and you can speak to that doctor whenever you want, within reason. I mean, if I'm in the operating room, you're not going to speak to me, but you may speak to me 10 minutes later. Now, here's an interesting case. We had a man came in on Thursday with prostate cancer. Now, he's been going to an alternative doctor for years. Now, what's an alternative doctor, really? Now, the medical profession, we get drugs. For example, digoxin, which is medicine for the heart. It's from the bark of a tree. We use adriamycin, a kind of chemotherapy. It's from the fungus in the sea. So doctors, legitimate doctors who use proven therapies, use drugs and treatments from wherever they are. If a woman is pregnant and needs a vitamin, folic acid, for the development of the baby, she gets folic acid, she gets a vitamin. But what's different is not using drugs indiscriminately. For example, tons of vitamins and tons of antioxidants. Ed, who's running this program in the studio here in WOR, just told me in Newsday there was an article showing that antioxidants don't work. It was in this week's Newsday. Well, a legitimate doctor is not going to give you a drug that doesn't work, that isn't proven. So what's the difference between a regular doctor and an alternative doctor? Well, you may want to stay on this side, the proven side, the side with data. And sure, you can go to a vitamin store and buy $1 million worth of vitamins and antioxidants and all that stuff, but you're on your own. And most of the data shows increased complication rates, increased death rates, increased heart attack rates. What happened to this man? Well, this man's been going to an alternative doctor for years. He has prostate cancer. Well, first of all, did the treatment work? Well, his PSA went from 30 to 50. It almost doubled. Well, so his tons of alternative medicines, number one, didn't work. Number two, he was being seen every few weeks. He came to me Thursday. He had a bone scan that day, which showed no spread of the cancer yet, thank God. We did a complete history and a complete exam and got blood tests. And what did we find? The man is in complete kidney failure. He's been going to the alternative doctor for years. He was never told he was in kidney failure, probably getting worse and worse and worse with all those things that were being given to him, or for some other reason. His creatinine, which is a measurement of the function of the kidney, which in most of us, you or me, is probably around 1, in him was 10. It's at the level of complete kidney failure, needing emergency treatment or dialysis. Emergency. His BUN was in the hundreds. His potassium was so high he was likely to have a fatal cardiac arrhythmia now. I've been going to the alternative doctor for years, and no one ever told him anything. He came to me for an hour and a half, staged his cancer, got a history, found his kidney failure, and took action. Wow, what a difference. If he hadn't come, he most likely would have died in the next few days. His potassium was that high, his kidneys weren't working. So just coming to us most likely saved his life. So what's the difference between a doctor who takes care of a patient, and in this case alternative, who's selling vitamins and antioxidants and this and that, and doesn't look at the entire patient? Well, it's pretty worrisome. It's very worrisome. And I think even that alternative doctor is very worried when I called him up to tell him that his patient had a creatinine of 10 and he was near fatal arrhythmia levels of potassium. Wow. And I want to talk about another patient. Another patient came to us. He has lung cancer. He was on Tarceva. He was here earlier in the year. We got him staged up. Then he was in a car accident, and he didn't come for several months. Finally, he came back. He had some pain in his arm from the car accident. His scans prior to getting in the car accident showed a nodule growing in the right lung and 2 lesions, very suspicious, in the liver. So he came to us. We are having him staged up completely. We're starting his treatment for the cancer, which is growing in the lung. His Tarceva, which he's been on for 2.5 years, isn't working. He's taking it because it's like a blanket. He feels comfy in it, but it's not helping him. So why take something if it's not helping? It just doesn't make sense. Drugs and Tarceva is a legitimate drug. If it doesn't work, it should be thrown in the garbage. It's not going to make the cancer grow less fast. The cancer's already growing. The drug is not working. Taking something that doesn't work continuously is just going to lead to trouble. And that's what's happening to this man with lung cancer. The Tarceva is not working. He's starting radiosurgery. What's our data? Well, we've treated about 20,000 patients. We follow patients, and actually our ability to stop or shrink or make a cancer go away for lung cancer, either in the lung or liver or elsewhere, bone, adrenal, brain, it's about 90%. So most likely we're going to stop this cancer, which has been growing on Tarceva for the last several years. Wow, last several years. And I just want to talk about this one woman before we go to a break. This woman came. She's a Polish woman, 58 years old, with ovarian cancer. She was seen elsewhere and proposed to have surgery and chemo. It's a newly diagnosed ovarian cancer, which I told her was, I think, a good idea. I think it was a good treatment. I talked to her about radiation. We often give radiation for ovarian cancer. I have one patient who writes articles in the newspaper how great I am, who I treated 20 years ago for ovarian cancer, and she's been in remission, so you understand her motivation. In Europe, radiation is commonly used for ovarian cancer. It does work in particular cases. I'm happy to see patients with ovarian cancer to see if they would benefit from it. And in this woman she was told stage 3, but actually she has a nodule in the lung, so she has stage 4 ovarian cancer. We talked about using radiation at the completion of her usual treatment to try to consolidate or try to make the treatment more durable, hopefully to get her into remission. So yes, we use radiation, radiosurgery for ovarian cancer. Of course, each case is unique, and that means everyone has to come in and sit down, and we talk about the case, the situation, the symptoms, the signs, whether any testing needs to be done, and how to best integrate different treatments to get the best results. We're going to stop for just a moment and hear from some new voices. My name is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center. We devote our work to brain tumors, cancer, prostate cancers, non-invasively, outpatient. People who wish come in, get a treatment, and go home or go to work. We're located at 38th and Broadway in Manhattan, 38th and Broadway in Manhattan by Macy's in Times Square. We're pretty convenient, but that's not the reason to come. We think we're pretty. So we'll be back in a moment.